Today we are going to review disorders of consciousness. You may know the mnemonics AEIOUTIPS, but in real emergencies, relying on the mnemonics isn't practical. Instead, let's build a clear framework based on how consciousness is maintained and what happens when the system fails. To stay consciousness, the brain depends on two key structures. First, the reticular activating system, or RAS, in the brainstem keeps us awake. Second, the cerebral cortex, especially when both hemispheres function together, allows meaningful awareness and purposeful behavior. If either of these structures is damaged, consciousness drops. This includes stroke or hemorrhage, diffuse cerebral edema, and CNS infection like meningitis, encephalitis, or autoimmune encephalitis. Also remember that non-convulsive status epilepticus can mimic a coma without visible convulsions. In third, the brain requires a stable metabolic environment, enough oxygen, enough glucose, normal electrolyte, and proper temperature. Disturbances such as hypoxia, hypoglycemia, hyponatremia, uremia, liver failure with high ammonia, CO2, narcosis, drug, or alcohol intoxication, or myxedema coma can quick suppress brain functions. And finally, the brain needs adequate blood flow. Severe hypotension, shock, cardiac arrest, dangerous arrhythmias, and major arterial occlusion or cerebrovenous sinus thrombosis can sharply reduce cerebral perfusion and lead to rapid loss of consciousness. So most cases of altered consciousness result from failure of one of these: the brainstem, the cerebral hemispheres, the metabolic environment, or the blood flow that supports them. Now imagine a patient with altered consciousness arriving in the ER. Before anything else, check three things immediately. Number 1, blood glucose. Hypoglycemia is common, dangerous, and reversible. Number 2, oxygenation. Measure SpO2 and correct hypoxia right away. Number 3, respiratory rate. A very low rate, especially under 8, strongly suggests opioid overdose or central suppression. These 3 steps alone often reveal the cause. Next, assess the level of consciousness using Glasgow Coma Scale so you can objectively describe the impairment. Quickly gather key information. Without that sudden rather seizure-like movement, could this involve drug ingestion, alcohol, suicide attempt? In the diabetic patients, especially those using insulin or sulfonylureas, always consider hypoglycemia early and ask about chronic conditions like CKD or liver disease, which commonly cause metabolic encephalopathy. Now check the vital signs systematically. Blood pressure low, consider shock, and high, think stroke, hemorrhage, or even aortic dissection, and obtain early imaging. And temperature, if low, hypothermia can itself worsen consciousness. High, think infection or heat stroke. Oxygenation, correct hypoxemia properly, and respiratory rate. And check pupils and gaze. Unequal pupils, possible herniation. Pinpoint, think opioid or wanting hemorrhage. Dilated anticholinergic or severe hypoxia. Gaze division, think focal structure region in the brain. Check briefly for weakness and look for tongue biting, which suggests recent seizure. Also evaluate for trauma because the mechanism often reveals the cause. Next, obtain essential labs: BUN and ammonia, STE, LT, and creatinine, PT, INR if you suspect permanent hepatitis, electrolyte, especially sodium, again blood glucose, alcohol level, and drug screening where appropriate. If the patient has COPD or suspected hypoventilation, check the arterial blood gas. Since CO2 narcosis is a common cause. A head CT is usually the first imaging study. If a major intracranial hemorrhage is suspected, the patient may be taken directly from the ambulance to CT. If CT and labs do not explain the condition, consider encephalitis, meningitis, diffuse infection, or subarachnoid hemorrhage. In these cases, perform MRI or lumbar puncture if appropriate. Before you finish the evaluation, quickly go through the mnemonics AEIOUTIPS. A, alcohol, E, encephalitis, electrolyte, I, insulin, O, oxygen, opioid, U, uremia, T, trauma and temperature, I, infection, P, psychiatric, poisoning, and S, stroke, shock, seizure. So the key principle is simple. In altered consciousness, treat reversible causes first. Stay calm, but act first. Good luck.